Welcome to Path to Nursing. Test your NCLEX knowledge with today's high-yield practice questions. Let's begin. Question 11. A laboring client develops recurrent late decelerations. Which nursing action should the nurse perform first? A. Increase the oxytocin infusion. B. Reposition the client to the left side. C. Encourage pushing. D. Continue to observe the tracing. Correct answer, B. Reposition the client to the left side. Rationale: repositioning the client to the left lateral position improves uteroplacental blood flow and is one of the first interventions for late decelerations. Question 12. Which fetal heart rate finding is considered reassuring? A. Recurrent variable decelerations. B. Moderate variability. C. Late decelerations. D. Prolonged bradycardia. Correct answer, B. Moderate variability. Rationale: moderate variability indicates a well-oxygenated fetus with an intact central nervous system. Question 13. The nurse notes a fetal heart rate of 100 beats/min lasting 12 minutes. How should this finding be interpreted? A. Normal baseline. B. Tachycardia. C. Bradycardia. D. Acceleration. Correct answer, C. Bradycardia. Rationale: a fetal heart rate below 110 beats/min lasting at least 10 minutes is considered fetal bradycardia. Question 14. Which intervention is appropriate when variable decelerations are noted? A. Place the client in the left lateral position. B. Increase the oxytocin infusion. C. Encourage the client to push harder. D. Place the client flat on her back. Correct answer, A. Place the client in the left lateral position. Rationale: variable decelerations are usually caused by umbilical cord compression. Repositioning the client may relieve the compression. Question 15. A fetal heart tracing shows accelerations after fetal movement. What is the best interpretation? A. Fetal hypoxia. B. Normal fetal well-being. C. Placental insufficiency. D. Umbilical cord prolapse. Correct answer, B. Normal fetal well-being. Rationale: accelerations are reassuring and indicate adequate fetal oxygenation. Question 16. Which fetal heart rate pattern is most commonly associated with uteroplacental insufficiency? A. Early decelerations. B. Late decelerations. C. Accelerations. D. Moderate variability. Correct answer, B. Late decelerations. Rationale: late decelerations occur after the peak of the contraction and suggest decreased oxygen delivery to the fetus. Question 17. The nurse observes minimal variability on the fetal heart monitor. Which condition could contribute to this finding? A. Maternal sleep or certain medications. B. Fetal movement. C. Umbilical cord prolapse. D. Maternal exercise. Correct answer, A. Maternal sleep or certain medications. Rationale: minimal variability can occur during fetal sleep cycles or after maternal administration of certain medications. Persistent minimal variability requires further assessment. Question 18. Which action should the nurse take if recurrent late decelerations continue despite repositioning? A. Notify the healthcare provider. B. Increase oxytocin. C. Encourage ambulation. D. Continue monitoring without intervention. Correct answer, A. Notify the healthcare provider. Rationale: persistent late decelerations require prompt evaluation and additional interventions. Question 19. Which fetal heart rate finding indicates fetal well-being during labor? A. Baseline of 140 beats/min with moderate variability. B. Recurrent late decelerations. C. Persistent fetal tachycardia of 175 beats/min. D. Prolonged fetal bradycardia. Correct answer, A. Baseline of 140 beats/min with moderate variability. Rationale: a normal baseline with moderate variability is a reassuring fetal heart rate pattern. Question 20, bonus SATA. A laboring client develops recurrent late decelerations. Which nursing interventions are appropriate? Select all that apply. A. Reposition the client to the left lateral position. B. Discontinue the oxytocin infusion if it is running. C. Administer oxygen as prescribed. D. Place the client in the supine position. E. Notify the healthcare provider if the pattern persists. Correct answers: A, B, C, E. Rationale. A. Left lateral positioning improves uteroplacental perfusion. B. If oxytocin is infusing, stopping it may reduce uterine stimulation and improve fetal oxygenation. C. Oxygen may be administered if indicated to improve maternal oxygenation. D. The supine position can reduce uteroplacental blood flow due to compression of major blood vessels. E. Persistent late decelerations require prompt communication with the healthcare provider. Turn on the notification bell so you never miss a new NCLEX practice session.